Well, thank you, Devoya, for the wonderful narrative. I just wanted to make sure everyone have a good time today. And housekeeping, today's presentation, is gonna be scheduled about 90 minutes. We do not anticipate taking all the time, but we want to leave space and conversation and Q&A afterward. We ask that you all please mute yourself and leave your comment and question in the chat box. If you like a copy of today's presentation, please indicate that as well, and we make sure we provide you via email. We have a short survey for all of you to participate. Please take a moment. I would say about a minute to 2 minutes to complete that survey. Please help us complete that survey as well. Well, look like we have a full house today. I would like to welcome everyone to Holistic Culture and Education Wellness Center. My name is Samnang Heng, and I'm one of the several culture brokers representing various underserved communities here in the Central Valley. If this is your first time joining us today, let me introduce you a bit about our service. Holistic Center is a program of the Fresno Department of Behavioral Health operated by the Fresno Center. Our physical space is located at 4867 East King Canyon Road in Southwest Fresno. We provide culturally and linguistically appropriate education, training, and linkage service to unserved and underserved individuals and families who may not typically seek traditional Western clinical basis mental health services. We fund it through the Mental Health Service Act, Prop 63, and have been providing options such as today's workshop for over 8 years. We know that in the US, 1 out of 5 Americans will experience mental health illness during their lifetime. On the other hand, 4 out of 5 Asian American persons with probable mental health illness do not seek care. So we are honored and tasked with providing this workshop today to enhance your resource and education information. Before I tune the spotlight to our guest speaker, I would like to inform you all that please complete our survey again. It will be in your chat box if you're familiar with that. And I encourage you to do that throughout. So that way you're able to click on a link for our survey for today. Like I mentioned earlier, the Q&A will be at the end of the presentation. We want to encourage you to have your question during the presentation time. Please to type your question on into the chat box so that way we can have that answer for you at the end of the session. I also wanted to encourage you. We will have this mental health workshop series from January all the way to June 2022. Please tune in for more workshop series, which is going to be held every month from January to June, and it will be at the same time, which is going to be every 3rd Wednesday. Look out for the flyer. I will create some more flyer for the next workshop. I will send out your way. And for that, I would like to welcome Dr. Ngo to introduce himself, and the floor is yours, Dr. Ngo.
Good afternoon. My name is Dr. Stéphane Ngo. So I was asked to introduce myself and introduce this topic on cultural factors influencing the mental health care of Asian Americans. I was asked, so let me introduce myself a little bit about my background. I'm a board certified psychiatrist. I've been in practice for about 15 years, 20 years, depending if you count residency. And I've practiced in multiple settings. I started my career doing inpatient psychiatry for about 4 or 5 years at a community hospital. And I've done consult liaison. I work in the community as well. I work in the state hospital, in the CDCR and prison system, which I'm currently working at. And I've done a bit of community work also different county, Fresno County, Tulare County. So I've done mobile clinic, I've done adolescent clinics, and I've treated people on probation as well. So I've done a little bit of a mix of inpatient and outpatient psychiatry. So let me introduce this topic of today's topic. So just a few disclaimer, and I've set up an introduction. Now I'm gonna try to speak as fast as I can, and that's the reason for this is because last time I ran out of time and didn't have enough time for people to ask questions towards the end. So I'm gonna I'm gonna leave about 30 minutes, an hour for this presentation, and try to leave about 20 to 30 minutes for questions that people may have. So just housekeeping on my side, disclaimer introduction. I don't have any financial conflict or conflict of interest. On the side note, Mr. Sam Heng approached me to give a series of topics on mental health. And he asked me whether I wanted to be compensated for my services, and I told him no. That's a community service that I'm doing as a psychiatrist. And I think it's important to pass on and share the information as far as mental health, educate not just my patients, but the community at large, whatever community, whether it's a county, whether it's a state or global. I'm all for providing mental health education as much as possible, especially in this day and age. When Samnang asked me to come up with a topic last month, we thought about a different topic, and he wanted to make something a little bit more specific to Asian Americans. So therefore came that topic on Asian Americans' mental health. So I am not an expert on this specific topic. However, I'm obviously an Asian psychiatrist by culture, by descent, and I'm multicultural, which I can speak about a little bit more. And I think I have a unique position, not as a patient, but as a physician, as a psychiatrist, to offer a fresh lens on this topic of mental health, specifically to the Asian American community here in the US. So outline, these are gonna be some of my topics of this presentation for today. I'm gonna talk about my own experience. The second thing, I'm gonna talk about statistics. Third thing, it's gonna be stigmas, and I'm gonna talk more specifically about the type of stigmas, internal and external stigmas, facing and fighting stigmas in general. The fourth topic will be culture, cultural identity, and connectedness and cultural empathy. Fifth will be cultural factors affecting mental health treatment in the Asian community. Six will be other factors, including age, gender, language, occupation, level of acculturation, and religion and spirituality. And seventh, the last topic would be treatment approach as far as mental health treatment for Asian Americans. So let's get started. So let me talk about my own experience. So as I referred in before, I was I'm Asian descent. My personal and cultural background. So I was actually born in Cambodia. And this is before the Pol Pot regime in 75. So before 75. So I was born in Cambodia. I immigrated actually to France, to Europe, at the age of 3. And I immigrated to the United States at the age of 16 to pursue my education here. So I always like to joke around. I'm cross-cultural. I'm a double immigrant. I'm double westernized to Europe and the United States. But obviously, my culture and my birth it's been in Cambodia. So, with that being said, I've growing up. Certainly, I can speak a lot about cultural differences and identify with different cultures. I identify strongly with being a French citizen of growing up, and I learned to speak. My first language is actually French, and my second language is English, and my third language is Cambodian. And at this age, I'm still learning to speak and write Cambodian. So there's never been an emphasis for me to speak and learn the language since I was young. My parents always told me, just pursue your education and just learn the language where you to learn to assimilate to the culture and to get better advantage of opportunities, education opportunities. So learning my own native language has always been in the back burner, which I am now coming back to. My own medical journey. So I actually did not start with psychiatry. I started my residency in internal medicine, and after a year, I decided I reached a point where I had to decide whether I was going to pursue what specialty I was going to pursue in medicine. And I became sort of disillusioned, and there was a factor of burnout also in the medical training. And I decided to reapply for two different specialties, and one was psychiatry, and the other one was physical rehab medicine. And I decided whichever program is going to take me first as a transfer from a medical program, that's what I was going to go to. So psychiatry was the first one to take me as a transfer from medicine. And so I attended a transfer from New York to the University of Maryland to start and complete my psychiatric residency. Just interestingly, just going back, but I was, when I was an intern in medicine in 2000 or 2001, I was actually a witness 9/11. In 2001, I was there doing my rounds with my team, and I saw the whole thing unfolding across the bridge in Manhattan. So we were right across in the hospital in Brooklyn. Right across the bridge. So just an anecdotal story on the past. But with that being said, I became, when I finished my training in 2004, I think I became one of the first US psychiatrists of Cambodian descent here in the US. Not saying I think there have been many Cambodians who grew up here as refugees or children of refugees, who went to medical school, but I don't believe the very few Cambodians who went to medical school here, very few became psychiatrists and chose psychiatry as a field. And I think I'm one of the very few. I know there's a handful, probably 10 at this point, 5 or 10 that came after me as psychiatrists of Cambodian descent. I've already spoke about my own experience as far as personal and professional. Like I said, I don't have any specific experience in treating specifically Asian Americans. However, obviously, practicing psychiatry in the last 15, 20 years, I've treated a number of Asian Americans, not specifically running clinic dedicated to treat that population, but I've treated many, many Asian Americans, including Cambodians, Lao, Hmong, Chinese, Korean, name it, I've treated them. So many anecdotal stories. I have countless stories of personal experience with but coming into contact with patients, with people who experience mental health symptoms as far as being Asian Americans. So I'm going to talk more about these as I go along, but let me move on just for the sake of time. So let's talk about statistic. Sometimes I think my slides are sort of cut off. So it's hard for me to read, to see everything because I'm seeing all the profile of people, the pictures. Do you know how I can minimize this? Yeah, okay, I can move the screen. Okay, I can move the screen.
Did you figure it out?
Yeah, I can move the screen. I was trying to minimize it. Oh, there it goes.
Okay.
Okay, I can minimize it so I can see my screen. All right, let's talk about statistics. So Asian Americans, as far as population in the US, we are about 19 to 20 million Asian Americans. And since the year 2000, Asian Americans have been one of the highest growth, have experienced one of the highest growth rate as far as racial and ethnic group. It's been also one of the most diverse group that includes over 20 different countries, at least 43 different ethnic groups, and speaking over 100 languages and dialects. So I always find it fascinating when people said, people who are non-Asians saying, group all Asians in one homogeneous group. And to say the least, there's quite a bit of heterogeneity within the Asian community by culture, by traditions, obviously by language, etc. So some of the things we share in common, and we have many differences and uniqueness to specific cultures. With that being said, Asian Americans experience mental illness at the same rate as the general population. So, and that's something we were taught very early in psychiatry is mental illness, whether it's depression and anxiety, which are the two most common mental illness in the general population. Those same rates apply to any ethnic group. So, however, the presentation as far as seeking help and the patient populations that psychiatrists or clinicians in mental health treat obviously differ quite drastically, and it has to do with patients not seeking care or not having many barriers or obstacles in getting the care that they would need. Less than 9% of Asian Americans are actually seeking mental health care. So that's one out of 10 patients with Asian Americans who actually get the care or seek the care that they need. And when you look at the general population, Asian Americans are 3 times less likely than their counterpart, than Caucasian, let's say, to seek mental health. 4 out of 5 Asian persons with probable mental illness do not seek care. So that's, again, 80 to 90%. So I think that's a definitely good salient topic to talk about and look at what is it that prevents or what kind of obstacles or barriers that prevent Asian Americans to seek the care, specifically to mental health care. So let's talk about stigmas. So more than half of the people with mental illness don't receive help for their disorder. This is just in general. Obviously, in the Asian Americans, it's much more. And it has to do with probably some of the concerns about being treated differently or having fears of losing their jobs or the livelihood. People with mental illness are usually marginalized and discriminated against in various ways. And I talk about different ways, different things that, as far as barriers and challenges that one may encounter. We can talk about recent public figures such as Olympic champions Michael Phelps, Simone Biles, Naomi Campbell. They all came out, in the past several years. Very famous people, athletes who came out and spoke about mental health, and I think that's I applaud their voice in putting mental health first, at least bringing it up to using their platforms to bring awareness as far as mental health and try to take away some of the stigmas as far as mental health is concerned. So mental health, let's look at some of the stigmas and why one may perceive mental health as far as stigmas. So it can be perceived as a mark of shame or discredit, can be perceived as a sign of weakness, or feeling less of, something may be wrong with you, or a mark of loss of honor or integrity, or a sign of disgrace. And all these could be associated with having a mental illness. Now, if we look at public stigmas, obviously, other people, the public, may have certain stigmas against people with mental health, and some of it we talked about and we'll be mentioning during this presentation. Self-stigma, so usually that refers to how one person feels towards, or internalizing the feelings about having a mental illness. And some of it comes, maybe a sense of shame that people with mental illness live with having a mental condition. And I'll talk about the more details about internal stigma or self-stigma. And then we can talk about institutional stigma, which is more systemic. And if you look at policies, for example, for research that the federal government allocates for research for mental illness, is significantly lower compared to counterparts physical illness. So there's still a lot of inappropriation of funding for treatment and advancement in mental health compared to other fields of medicine. Then we can talk about stigma within the medical community. So let me pause here for a minute. And, when I switched to, when I actually went through medical school, we rotated through the 5 different specialties of medicine. And those are medicine, surgery, pediatrics, OBGYN, and psychiatry. Those are the 5 core subjects of medicine. And I remember going through my 3rd year, everybody thought, psychiatry was sort of the most kickback rotations, and which is true. It's probably the most laid back, the less regimented medical specialty. But there's also a lot of stigma, so much so that I didn't even think about going to psychiatry when I was a medical student, and it was really an afterthought after I finished my 1st year of internal medicine. And there's still a lot of stigma. There were still a lot of stigma at the time. Just to share a little bit some of the stigmas, both my parents are physicians, trained in Cambodia under a French system. And my dad is an OBGYN, and my mother, who passed away now, it was an infectious disease. And when I told them that I was switching from internal medicine to psychiatry, they absolutely thought I lost my mind. And, because back in the days, psychiatry was never thought as a quote unquote real field of medicine. And so, there's always been the stigma attached to within the medical community. So just looking at stigmas overall, it happens even in our medical field. And to this day, I don't think, of a specialty don't quite understand what psychiatry do, as far as, because the diagnosis and the treatment are not as well defined as other field of medicine. The measures are not as well defined. So, but in that sense, it creates a lot of discomfort or, uncertainties with the objective science of how we, as in medicine, are used to approach diagnosis and treatment. So let's talk about a little bit more about internal and external stigmas. So internal stigmas can be things like where a person usually may feel embarrassed and ashamed in opening up and diverging personal, very personal, and even less so his or her mental health issues. They can be fear of being perceived as quote unquote crazy, less of, weak, handicapped, unable to fulfill family or work responsibilities, unable to pursue education, and unable to succeed. Then there's in the family and community. So for many Asian individuals, the value of a person is very much tied into the value that one has with his or her own family, and certainly to the community that he or she lives tends to associate themselves with. So, and I'm not saying that's just with Asian Americans. I know Hispanic and many other cultures emphasize family as a unit and less individualism. And but this is when you look at the traditional American value of individualism and the pursuit of happiness and success, so those two may conflict. As being an American, also obviously we all view ourselves as very independent, as very individualistic, and we make our own choices. We're in full control of our future, and that's irregardless of where we came from or our family structures. So there's a strong sense of individualism in the US. And I can certainly see both sides. I grew up in both cultures, the West and the East, the Asian and the American, actually the European also. So I can certainly see the contrast between those two. Now, the stigma, there's a lot of stigmas and misconception that mental illness diminishes or takes away from what Asian may value. And those things in a lot of Asian community or individual, that has to do with honor and respect. And everybody, there's a strong emphasis on those two qualities of honor and respect. So external stigmas usually are those what other people perceive of Asian Americans or Asian in general. So sometimes Asians are being stereotyped as being intelligent, hardworking, highly educated, high achievers, and successful. Obviously, we know, I know very many successful Asian Americans, but I also know many not successful or people who just the full gamma of classes of education, social class, etc. of Asian Americans. So I think just for people to stereotype Asian Americans in that box, that stereotype box, I think limits in how we think and as a group and how we behave as people in general. Also, there's a stereotype or stigma that Asian are usually reserved and quiet people who are usually stoic, meaning they don't show much emotions, or weaker in general. They don't speak their mind or don't complain, certainly don't complain and don't seek out mental health help for their issues. Thirdly, Asian Americans don't face the same socioeconomic challenges as other racial groups, which obviously, all none of the stigmas or stereotypes are true. So a lot of Asian Americans do face very similar challenges, socioeconomic challenges than any other racial groups. So it's the same for all of us. So how do we look at facing and fighting stigmas? So, I try to put some thoughts into some more practical things that I would recommend. And one thing would be open and share. It's not easy to be open and share things, including for myself. I tend to be more introvert individual, but I think it's important for people to understand where, as Asian Americans, where what are our aptitudes, what are sort of personal preferences, and how we are functioning as people in general, if we are open and willing to share. And then when there are stereotypes presented in front of you, I would say challenge them. Challenge them without being confrontational and challenging by educating the person. If they say, well, I'll give you an example. When I was in medical school, everybody thought, just because I was Asian, I should be at the top of my class. And when it didn't come that way in certain class, I said, just because I'm Asian doesn't mean I'm gonna be at the top of my class for everything and every topic. So I did challenge those stereotypes, even among my medical students, friends at the time. I would say develop cultural empathy. And when I talk more about cultural empathy, how I defined it and what it's all about. Learn to trust mental health professionals. Feel more comfortable in talking about mental health issues. And then I think we all need to, as clinicians or people in the mental health field, to sort of get in conversation, try to normalize mental health without stigma, just like any other chronic conditions like diabetes, hypertension, high cholesterol, obesity, and talk about it just as it deserves, just like any other medical illness that carries the same emphasis and the same importance as any physical illness. And then lastly, work with community activists and leaders, spiritual and religious leaders, teachers, and other professionals, both in the mental health and in non-mental health and within the mental health system. Try to educate and try to face and fight some of the stigmas together. So let's look a little bit more into cultures. So per Wikipedia, culture is an umbrella of terms which encompasses the social behavior and norms found in human societies, as well as the knowledge, belief, arts, laws, customs, capabilities, and habits of individuals in this group. This includes expressive form of art, music, dance, ritual, religion, technologies, and tool usage, cooking, shelter, and clothing. So it's quite a bit of, when we talk about culture, we're not talking about one specific thing. I mean, it encompasses all these different entities within the culture. So I'll give you an example. So I always struggle with my own cultural identity. And, I always said, just because the fact that I don't speak perfect Cambodian does that make me less of a Cambodian person. And I've always struggled with that up to this age. And vice versa, because I speak perfect French without an accent, doesn't make me French per se. So I've struggled with, and I came to this age and I realized that, I'm all three, and I can identify with all three cultures, and doesn't make me less of, but actually I think it makes me more of, and be able to be culturally diverse and be able to relate and appreciate all my different cultures that I've lived through. So to better understand a particular culture, and I put Asian, one needs to understand how individuals operate within a specific family, social, and community bubble. And to reach out to traditional healers, religious leaders, monks, priests, shamans, community advocates and leaders, teachers, especially like arts, language, etc. And then thirdly, to appreciate differences between each specific cultures, and really the beauties in each and every specific cultures, subcultures within the Asian community. So let's talk about cultural identity and connectedness. So cultural identity, and I already spoke about my own cultural identity. Actually, I went through 3 cultural identity. So when growing up, I used to think because I speak perfect French and I dream in French, I must be French, but when I look myself in the mirror, obviously I'm Asian. And I remember growing up and not being connected with my Cambodian culture, and that had to do with a lot of emphasis that my parents put in saying, it's sort of a dead language, and to move forward and seize the opportunity as an immigrant, I should speak perfect French, which so I concentrated in that. When I came here in the U.S. At the age of 16, I gave up my French, and then I've learned to be more fluent in English. But then did that make me more Americans? So I've struggled through years trying to find my own cultural identity, and I finally accepted that I'm comfortable in identifying with all three cultures. I mean, Americans, French, and Cambodian. Let's talk about first generation versus second or third generation Asian Americans. So I think one has to keep in mind when seeing patients in the Asian community, just to understand what generation are we actually treating, because there's going to be significant differences between treating or offering mental health services to an immigrant first generation who refugees. So I give you an example: refugees who first came here and still don't speak English that well, and are not, quote unquote, assimilated into the American culture, versus an Asian American who was born here and may have very westernized viewpoint. So I think one, as a mental health clinician, one should keep that in mind and sort of be not appreciative of the subtleties, but also the approach in how one would want to approach this different generational gap between Asian Americans. And then there's the general concept of the immigrant mentality. So what I meant by that, by this is, I mean, I can speak to myself. I'm a double immigrant, so it's we as immigrants, there's a lot of stereotype. I can talk about stereotype stigmas that people outside Americans think, people who come here, or takes people's jobs and don't add up to the community. Well, I think of the opposite. I actually think immigrants or come to this country with a sense of purpose and want to better their life. And I think that all immigrants, who have the opportunity to come to this great country, always want to chase opportunities as much as possible, whether it's education, joining the workforce, and then one should be really appreciative of the great opportunities that is offered in the United States. The general concept of assimilation. So let me pause here for a minute. I mean, I've talked about assimilation in general, as giving myself as an example, but there's got to be some resistance depending on the individual. Some Asian Americans, like I said, who I give you an example. My wife's parents are refugees from the Khmer genocide, the Pol Pot regime, the Khmer Rouge. And when they came to this country, they still, 30 years after coming to this country, they have not assimilated to this country fully. By that I mean they don't speak English. They are at home with primarily spoke Cambodian and associate themselves within very Cambodian traditional community where they speak only Cambodians and do things that are very peculiar to that cultural bubble. In contrast, my parents were very westernized. They learned medicine in Cambodia in French. And when we immigrated to France, when parents continued their training in France, they always spoke the language. They were very well assimilated to the West, to the Western culture. And just by history, as many of you may or may not know, Cambodia was, and Vietnam and Laos, part of Southeast Asia, was colonized by France for, I think, 80 or 100 years. So we have a long tradition of being, a period of assimilation back in the days. Then there should be an appreciation and preservation of one culture through multi-generational families. So, but what I mean by that is how does an Asian American family pass on the culture for their children and their grandchildren through art, through culture, through music, through language, through whatever methods. And I think there should be more efforts in appreciating that and preserving every culture in every generation. And I think that's lost with every generation. And I know very well, because I'm guilty of myself. When I grew up in France, I was told to sort of move on and don't learn my language and don't worry about my own culture. Well, that came, as I got older, that sense came that I had a strong affinity to learn to reconnect within my own culture, and it's been going on. I think in my late 30s. So for the last 20 years, I've developed a strong appreciation and wanted to preserve my own culture, which I didn't when I was much younger. So I think it's important that every family has this discussion. Asian American family have this discussion with the family and see how they want to pass on this legacy of a specific culture. Let's talk about cultural empathy. So what's the definition and what do I mean by that? So cultural empathy, I think one needs to learn to appreciate the history of a specific Asian culture, what's similar, what's differences, the beauty of it, and be sensitive to each cultural norm. So whether you're Asian Americans or you of a different ethnicity, I think if you don't know, ask with a sense of curiosity and respect. What do you mean by that? And I give you an example. I didn't know. I knew very little about Hmong, and I had to ask and inquire to see what Hmong, what's the culture and how. So I asked some Hmong people as friends. I've had Hmong friends. What are their experiences of their culture, etc. So you can be even Asian, like I said, and not know about another Asian culture. So I think asking with a sense of curiosity and respect will help you be more sensitive to and develop cultural empathy. Be sensitive to concept of politeness, respect, especially with older individuals. I.e., wisdom comes with age, and it's very much emphasized, I think, in the Asian culture. I'm not saying it's not emphasized in other culture or Western culture, but certainly in the Asian, even the Asian Americans, being respectful, especially with elderlies, is very important. So much so in Cambodian, when we call different people, whether brother or sisters or uncle, whether they're true uncle or aunt, there's different name for just to show respect, whether they're older than your parents or younger than your parents, etc., or older than you or younger than you. Be sensitive to topics that may be accepted or taboo to talk about. So including mental health. So I'll give you an example. I haven't, not by lack of interest, but I haven't come into many Cambodian refugees who want to be open and talk about mental health issues relating to the post-war. So people who went through the Pol Pot regime and who lost families, it's still to this day a very sort of not taboo, but you're gonna find that very few Cambodians who went through the Pol Pot regime are willing to open and talk about it. Because when you talk about trauma, which in general for post-traumatic stress, it can be a painful process. It can reopen old wounds, and the work, unfortunately, the work to move ahead and get treatment and get better, it can be painful. And even though I don't do a therapy per se, and I always encourage patients to be open and to work with the therapist to be willing to open up about past experiences and trauma in order to deal with these feelings and get better in general. Be sensitive to demeanor, gestures, stance, body language, look, tone of voice, and communication norms. So every culture, I think, within the Asian community has, different, just even in general, you can, patients or people, communicate through all these different modes. It's not just verbal communication, obviously. Just like when I do my own mental status exam, as I'm seeing patients, I record all of this. So it's sort of, it's a physical exam for psychiatrists. So I do record any gestures and the demeanor, whether they're anxious, whether they present as agitated, calm, whether the patient may present with certain body language. So I do document all of that in my mental status exam. Cultural appreciation of various tradition, again, that comes through not just language, dance, music, food, dressing, etc. So all those are part of culture and appreciating a specific culture. Each culture, again, has its own unique and rich history, but also face a multitude of similar but slightly different challenges. So I already talked about some example in the Khmer or Cambodian community about the Khmer Rouge genocide during Pol Pot, and that people who've gone through this may still carry the scars of the trauma. And I'm sure many of these individuals suffer from PTSD, post-traumatic stress disorder, and have symptoms of that. And very few actually get the help, professional help. And I'm not just talking about medication, I'm talking about therapy, about other allied health treatment that may help improve some of the symptoms. Vietnamese, for example, look at the pharmacist to prescribe medication or give general medical advice, and only complicated cases will get referred to a primary care provider. This is sort of part of my ignorance as far as, among the Hmong community. So I did not know, what religion Hmong were. I thought most Asian were Buddhist by culture, but I found out that they're not. So I had to learn a little bit more what's a shaman, what's the role of a shaman, and what is their traditional belief or religious belief or religion. Okay, so let me switch gear and talk about summarization just for a minute. I'm not going to emphasize it a lot, but it's just to talk about the spectrum of how Asian Americans may present as far as seeking help for mental health treatment. So Asians are more likely to express psychological distress as physical complaint. So one of my primary care physician colleague who I went to medical school with, he's a family dog, and he always tell me, he used to tell me that, you know, I see a lot of Asian patients, especially older Asian patients, who come to the ER and asking to give him ocean water. And what does it mean? And it's almost like a placebo effect for whatever ailment one may feel, even psychological or mental health issues. And if you just give them an IV fluid, they will feel better. And that's all he did. He just gave them IV fluid, and their symptoms, and they will report feeling better. So it's just this either placebo or more acceptance to report physical complaints and disguise psychological symptoms or mental health symptoms instead. And like I said, it's generally more accepted to report physical complaints rather than psychological. So for example, when a patient may seek a medical doctor to address a racing heartbeat or problem with sleep, insomnia, or constant headaches, those may be more accepted or perceived rather than to admit to anxiety or depression or addiction problems or any other psychiatric disorders. In mental health, be aware of, you know, somatization disorder, hypochondriasis, conversion disorder. So I'm just going to define those just to keep those in perspective. So somatization has to do with the production of recurrent and multiple medical symptoms with no discernible organic cause. So the reason I brought it up is, you know, patient may come who may have mental health symptoms, may come to the office, to the general practitioner office or to the ER, complaining of multiple medical problems, headache, you know, pain, you know, or whatever symptoms, physical symptoms, and have a tendency to attribute their mental health symptoms to physical ones. And then hypochondriasis has to do with one being sort of obsessed with the ideas of having some type of serious but undiagnosed medical condition. And conversion disorder has to do with a person who may believe that he or she has some kind of neurological problems, such as blindness, paralysis, or other neurological symptoms. But those symptoms usually cannot be explained by medical evaluation. So sometimes some of these people may suffer mental illness or mental health symptoms and show up to the office complaining of neurological symptoms. Okay, so other cultural factors affecting the mental health treatment in the Asian community. So as I've referred before, there's quite a bit of variability as far as heterogeneity within the group of the Asian community. And a lot of it has to do with, you know, the degree of acculturation, of socioeconomic status, and immigration status, family structure, and intergenerational issues. So, for example, academic and professional pressure for success. So Asian Americans or Asian in general, there's a strong emphasis to, quote unquote, become an engineer or a doctor. And a lot of emphasis is put on academics. So if one is not able to achieve, you know, higher education or high professional success because of mental health issues, you know, all mental health issues actually may be put on the back seat. So, you know, some people who are very successful are not putting their physical and mental health in the forefront their care. Integration. So many Asian Americans see themselves as part of a group that's seamlessly integrated into their new society. Characterization. Many Asian Americans see themselves as intelligent, industrious, and fully in charge of their lives. For many, admitting to weakness would be letting down the entire community. Stereotype, again, of being intelligent, hardworking, highly educated, high achievers, and successful can put quite a bit of burden on an individual and impact their mental health as well. Then there are certainly traditional beliefs about mental health that can maybe a barriers to seeking or getting treatment for mental health in the Asian community. And then other factors include age, gender, occupational, and I'm going to talk about all of these separately in the next slides. Let's talk about tradition. I'm going to go on for about 10 minutes. I know I'm running just about 50 minutes now. So traditions in the Asian Americans, a great value of tradition is put on the family as a unit. And there's certainly a lot of hierarchy and especially emphasis to the elderlies. And in many traditional beliefs, mental illnesses are caused by a lack of harmony of emotions and sometimes are created by evil spirits. In Buddhism, there may be a belief that mental health problem may be a transgression committed in past life, and we even have a word for that in Cambodian. It's what you do in this time. You get bad omen in the future in your next life. So there's this tradition of thinking as life cycle, not just to hear the present, but also the afterlife and the life before. In traditional Chinese and Eastern medicine, they may use herbal therapy as a first line instead of medication, use acupuncture or meditation, yoga, etc. So other things, and usually there's other traditional providers of Oriental medicine that do specialize in more Eastern approach of medical treatment and mental health treatment. Religion and spiritual belief. Again, I talked about Buddhism, which tends to promote, understanding disease causation. Then you have Confucianism, Taoism, and I'm not going into details because I'm not expert in those. And then in the monk community, there could be animistic, and that's the belief that in the spirit world and the interconnectedness of all living things. And this is something I actually had to learn. And the role of the shaman, which literally means father or master of spirits, and how in the monk community, how they function as far as their religion and spiritual belief. Language barrier. So when treating Asian Americans with mental health, I think obviously many Asian may not have full fluency of the English language, and just to be aware that there's quite a bit of languages, and languages are usually spoke within the family structure, sometimes more emphasized than it depends on the family structures. Like I said, mine, they did not emphasize learning my native language, where in my wife's family, they emphasize strongly to the point where she's very fluent to this day, and I'm not. There's a linguistic isolation, so that's what I refer to when language is spoken, the native language spoken at home entirely, and instead of English or a mix of the two. And the concept of loss in translation. So I'm fully aware that there are certain words, verbiage, metaphors, and subtleties in every language. So even if you use a language interpreter, there are certain things that words that cannot be translated. And so one has to appreciate some of the loss in translating for an Asian individual who may not speak English fluently. And then studies have shown that language barriers and a lack of awareness of where to get help does come in a way of Asian Americans seeking mental health care. Certainly using bilingual services help, but I use bilingual services with my Spanish patients, but I'm fully aware that some of the content may be lost in translation. Acculturation, so by that I mean a cultural assimilation, so which is a process in which a minority group or culture comes to resemble society, majority group, or if you mean the value, behaviors, or belief of another group, whether fully or partially. And then there's a certain level of acculturation, so it differs on individuals. Some people may be very well assimilated, and some people may resist depending on the generation of Asian Americans and really the family structure. Age, so in treating Asian Americans with mental health, I think younger people who were born here or immigrated very early may be more readily adapted to Western approaches and maybe more willing to seek mental health care, whether it's through therapy or through other allied health, or see a psychiatrist. Whereas older Asian Americans may have more resistance to seeking mental health care. Occupational issues, undocumented workers or immigrants may not feel comfortable in seeking help for whatever legal reasons, or not feeling that they may be understood, or may not be able to speak the language or communicate in English well enough to share their mental health issues. Prior occupation in the old country, so there may be individuals in the past, and I've known of some of these people. Sorry. So there may be not possible. So there may be, sorry about the alarm. So there may be individuals in all countries who were, I know of Cambodian who were doctors, who were physicians in the old country, and they will come here and because we are not able to practice in this country and having to retrain and go through medical school in this country, may have mental health issues because they're not able to fulfill prior occupational status. There may be a fear of work repercussions. So if one opens up at work, and this is true in general also, not just with Asian Americans, but if one opens up about their mental health issues at work, they may be discriminated against or being thought as less capable of doing their work. Double discrimination, by that I mean due to the race, ethnicity, and culture that's compounded on stigmas or of mental health or mental illness. So let me talk about treatment approaches for 5 minutes, 5-10 minutes, and then we'll wrap things up. Cultural empathy, sensitivity, humility, education, respect, and curiosity. So I thought these were all things that should be upheld when treating patients with mental health issues or Asian Americans. Be aware of individual patient demography. So whether the first generation, second generation, and Asian Americans, what are the patients' belief? And you can ask them, how do they feel about mental health? What have they ever discussed any of these issues with family, with friends, with professionals? So just try to see where they're at and what's the preconception of mental health in general, and try to elicit a more explanatory model. So I usually put myself in a very curious stand, and I ask, help me understand or explain to me, what you're going through or what you're experiencing, and put the bar on the patient's court rather than me being so directive and eliciting symptoms from patients per se, because I don't think any patients will not feel comfortable in just going straight into the symptoms, and there's certain tact and cultural sensitivity that one may need to approach when treating patients with mental health in general, and always follow the patient's lead. So usually whatever the patient wants to talk about, that's why I'm going there first. If they don't want to talk about mental health issues, I'm not going to talk about mental health issues in my first few sessions. Obviously, the goal is to get them the help as far as mental health, but there's certain session what I call seasoning session, where you just trying to create a therapy relationship with the patient, to learn to trust the provider, and to open up and talk about, eventually mental health issues. Negotiating around acceptable diagnosis and treatment. And again, I've talked about in my previous talk about matching up treatment with the stage of change. If a patient or individual is not ready, has never thought about mental health, has never discussed mental health, and I'm going to offer them treatment with medications or with therapy, obviously there's a discrepancy between where the patient's at as far as their engagement and their knowledge and engagement and my treatment. So one has to be aware to be able to meet where the patient is at the time. And then think about gateway to mental health, and a lot of mental health issues are first being seen by primary care doctors. Anxiety and depression go to usually seen by general practitioner first, and most antidepressants are actually prescribed by primary care provider rather than psychiatrists. But that's okay, and then we get the referral. At least we get referrals from the primary care, and certainly for difficult cases and more challenging, we get referrals to mental health. And I said use family support to increase adherence to treatment, or even seeking help. Lastly, I'm going to talk about treatment approaches as far as be aware of your clinical bias, your countertransference, so your own feelings about the person or about mental health issues, or how you may feel about another individual. So for example, if I were to treat a Cambodian patient, how would I have to keep my feelings as far as how I feel about them being my patient and being Cambodian per se. I think gentle psychoeducation and normalization of the topic of mental health should be a first goal. Setting clear expectations of how long sessions are gonna be, how long will it take to see symptoms improvement, and then thinking about how we can better outreach mental health services in a non-traditional ways, instead of having the patient come to the clinic, go to do outreach in the community. I use actually to run from a mobile and from an RV and go to Wood Lake and see patients, mostly Spanish patients who did not speak English, with my Hispanic nurse, and used to deliver mental health and psychiatric services to people who normally would not be able to have access to mental health and see a psychiatrist. And then lastly, I put those examples as during sessions. So, asking a patient, how do you feel? May not be, maybe perceived differently with Asian Americans, because Asian Americans may not feel comfortable talking about the feelings. And usually emotions and feelings are usually redirected into something else, such as sports, academic, school, etc. And we tend to put, mental health issues, whether, anxiety, depression, on the back burner, and then just move on and redirect those symptoms to more productive activities. The meaning of silence. So those can be very subtle with Asian Americans compared to Western. So silence can be interpreted as, in the Western culture, as that you agree, whereas in Asian culture, it can mean different things. It can mean that one disagree with what you said. It can mean a number of things. So the meaning of silence is very different in the Asian community. And then also direct versus indirect communication. Direct communication may be perceived as a sign of disrespect within the Asian community. If I ask directly, do you want, have you had any thought of suicide? Maybe very disrespectful, within older Asian, American Asian individual. And again, there's no magic pill out there. And I've always emphasized this as a psychiatrist. My goal is always to reserve medication as the last resources, and to use other modalities as for good mental health treatment. And that is therapy, other allied health. The more we can invest in treating our patients, the more I think they will get better. And again, mental health takes time, and it's a personal investment on yourself, on your family, and in your community. Hello?
Hello. Well,
Hello?
Can you hear me?
Yeah, I'm sorry, I'm not stopped here. I was kind of worried because I didn't hear anybody, so I wasn't sure whether I lost connection.
Okay. We're down to 10 minutes for respectful of everyone's time. So we're gonna have a Q&A for the last 10 minutes. And please, not all at once. You can unmute yourself and go ahead and ask any question you may have during this for this presentation.
Maybe we can stop the share screen so folks can see Dr. Ngo also in his full brilliance.
Of sharing.
On the little green. There you go.
Okay, there you go.
Oh, y'all don't want to see me though. Let's see.
Now I can see everybody. I wasn't sure who's present.
There you go. You have a whole gallery of folks here today. So we realized that was a lot of information, and we are so happy to have you all here with us today. If anyone has any questions that they would like to ask our guest speaker, if you don't feel comfortable asking them yourselves, you can also put them in the chat box, and myself or Sam would be more than happy to ask those on your behalf. Miss Joy.
Well, I don't actually have a question, but I just wanted to say thank you. It was a lot of informative information, and I've learned a lot in this span of time. I just want to say thank you.
Oh, you're welcome. Yeah, I tried to, I'm sorry, I tried to rush through each slide, and I want to make sure I have enough time, because last time I ran out of time, so I want to make sure I get all the slides. And I made all these slides available to Stephane, so, you know, feel free to share it. I don't, you know, it's just something. And again, this topic was not, I'm not an expert, you know, I have to do a lot of research and myself coming up with this topic. And, you know, I've learned quite a bit also on this topic.
I want to piggyback on what Ms. Joy just said. I too found this so interesting, and there's so many different nuances to it that really speak to all of the folks that are in the room. This is a really diverse group of folks. And when you talked about the collectivism versus the individualism, assimilation versus acculturation, those are all individual topics we could even expand on even further. And we really don't, there aren't a lot of places that encourage those types of conversations. So I just really want to thank you on behalf of the center for making this available to us. And I'm going to press stop recording now. So and just let folks know that this full presentation will be available on the Holistic Center YouTube page soon. So yes, I just wanted to say thank you as well.